Okay, so we have an article today, and in this article it shows that about 80% of COVID patients are deficient in vitamin D. And guys, congratulations, it's especially low in men. Women do have low vitamin D levels, but more men than women have this low vitamin D. So why should this even matter, right? I mean, who cares if you have a low vitamin D or if you have vitamin D deficiency? Well, it turns out that vitamin D plays a role in the COVID infection. So vitamin D is very important for boosting your immune system. So if you have low vitamin D, obviously you're going to have a harder time fighting off any infections. So it doesn't just play a role in COVID, it also plays a role in heart disease, in diabetes, even in multiple sclerosis. And if anything has come out of this, coronavirus, COVID-19 thing that everyone, is having such a difficult time with, is that it has alerted us to the real value and importance that vitamin D plays in our body and in our immune system. Vitamin D even plays a role, there's an association between vitamin D and HIV, hepatitis, even just regular flu. And again, you can point directly to how vitamin D affects our immune system. So it turns out that those in the study who had either elevated levels of vitamin D or had supplemented with vitamin D, they actually had better outcomes than those who had low vitamin D. Now, let's be totally clear here, vitamin D is not a cure, and it likely doesn't have anything to do with whether or not you contract the virus from somebody else. It just has to do with fighting off the disease, boosting your immune system, strengthening you, and making you more likely to have better outcomes and more likely to survive this deadly disease.